The April 3rd Select Board meeting. Please note that in accordance with the emergency orders announced by Governor Charlie Baker to protect public health during the COVID-19 outbreak, the April 3rd Select Board meeting will not be open to the public for physical attendance, and the Select Board members are calling in to this Zoom meeting. The meeting is being live streamed and cable broadcast by the Easton Community Access Television, Comcast 98, and Verizon 23, and on ECAP's website at www.eastoncat.org. Connor will speak a little bit more of the details, but first I'd like to ask each select board member to state their name just to ensure that we have a quorum. And this is Dottie Fulgenetti.
This is Craig Barger.
Mark Lamb.
And Tom, are you on the call still?
Am here.
Okay.
Tom Broussard.
Great. So we do have a
Can you
quorum.
hear me?
We can hear you.
Great.
Excellent. Thank you everyone for being here today. This is the first time that we're trying out the Zoom call, so it's new to all of us, and so far so good. So we're going to turn this over to Connor if you want to do the presentation of the COVID update.
Sure. Thank you, Dottie. Anyone who's listening in without video, this is Connor Reed. I'm the town administrator here in Easton. I'm going to give an overview of the town's ongoing emergency management and response to the COVID crisis. I'm going to start with kind of a 10,000-foot view overview, and then the Fire Chief and Emergency Management Director, Kevin Partridge, will talk about public safety responses. Director of Health and Community Services, Kristen Kennedy, will highlight our public health responses. And then I'm going to bring it back with a summary of what the ongoing challenges are for us as an organization and a community moving forward. So first of all, a couple of acronyms. EMA is the Easton Emergency Management Association. EMA leadership, which includes various public health, public safety, and operations management officials, continues to meet 7 days a week to assess or when I say meet, I mean conference calls. We're practicing social distancing. We continue to speak every day of the week to the COVID-19 crisis locally, regionally, and nationally to inform our ongoing local response efforts. To support the necessary ongoing response planning that we need to do, immediately following the governor's declaration of a state of emergency, EMA established numerous interdepartmental and cross-sector working teams that are focused on specific areas of municipal and public service provision to continue to anticipate and respond to the evolving challenges presented by COVID. Those working teams are shown on screen. We have an executive planning committee, a board and committee official act, working group, financing government operations, inspections and community services, logistics, supply chain and building management, personnel and labor management, public health, nursing, athletics and community events, public safety and emergency responses, and then a vulnerable populations working group. So just to give a kind of recap, it feels like it's been eternity, but most of these major changes have been happening in the past month in Massachusetts. So this screen has a summary of key action that's been taken by the Commonwealth under Governor Baker's leadership during the month of March, and I've added a couple of important local actions that Easton took in italic font. So on March 2nd, Massachusetts confirmed its second COVID case in the Commonwealth, and that same day, Easton's emergency management team had stood up a COVID task force before that, and they began meeting on that day, the first day that there was any spread of COVID in the Commonwealth. The next week, on March 10th, the governor declared a state of emergency in the Commonwealth. The morning after that, EMA had an all-hands-on meeting where we established those 9 interdepartmental and cross-sector working groups to continuously manage and respond to the ongoing crisis. On March 12th, the governor issued an order amending or modifying open meeting law, which made possible meetings like this. The next day, EMA, both town and school officials, decided to close Easton Public Schools, the town offices, and Frothingham Hall proactively. This was before we had our first confirmed case. That proved prudent. The next day, we did get our first confirmed COVID case in Easton. At that point, the governor established the Coronavirus Response Center, which is an interdepartmental state governmental response unit. Shortly after that, Governor Baker ordered the closure of all public schools in the Commonwealth. That has since been extended through May 4th. The first day of the week after that, on Monday, the Select Board and the Board of Health voted to declare a state of emergency. All playground and park group play was suspended. Following that, on the 18th, there was closure of non-essential daycare and childcare by the governor. On the 23rd, there was a closure of non-essential businesses to the public, prohibition of gatherings. Following that, the DPH gave their stay-at-home guidance, and they continue to issue a significant volume of emergency orders on a near daily basis. The Commonwealth publishes lists of all of the state's ongoing emergency orders at the URL that we have shown on screen if you go to mass.gov/COVID-19. Also, as folks saw on the news, I believe yesterday, forgive me, it blends at this point, Governor Baker was able to get very creative and secure over 1 million N95s working with the Kraft family and the Patriots. And so the Commonwealth continues to get creative and apply all the force that they have to this crisis. So just a summary, as of this morning, Easton has 38 confirmed cases of COVID. You see our graph here. You're probably seeing very similar ones for Massachusetts, the United States. So our first confirmed case was the 14th. We had one for most of that week, and since then we have been steadily increasing, which is typical for the Commonwealth of the United States. This is a graph courtesy of WBUR for reported cases in Massachusetts. As of this morning, Massachusetts has 8,966 cases with 154 deaths. And this is harder. The scale is so much larger. This is harder to see. This is courtesy of Johns Hopkins University, who have a really incredible COVID-19 GIS dashboard that I encourage people to visit. The URL is shown on the bottom here. The United States, as of this morning, per Johns Hopkins, was at 245,658 cases with 6,069 deaths. So getting into a little bit more detail, for town-wide municipal services, the town offices in Frothingham Hall remain closed to public access until at least May 4th. This mirrors the governor's orders on the continued closure of public schools. For that period of time, folks are still working. Limited personnel are reporting to offices for essential functions that can't yet be performed remotely. However, we have dramatically scaled back the number of employees coming to non-emergency operations in order to protect their health and the public health and reduce the spread of COVID. And we have rolled out the necessary technology for nearly all administrative personnel to be working from home, not just for their day-to-day internal functions, but also doing things like returning phone calls to the public, doing online permitting and bill payment, and responding to emails and triaging work in that manner so that we can continue to provide as much service as is possible given the state of emergency. So most of our municipal services continue to be available remotely through phone or email. In the past couple of weeks, to help build out our capabilities to assist the public and keep delivering services, we have launched a dedicated COVID-19 information line. The phone number is displayed here on screen. That's available during business hours, 5 days a week, for folks who maybe have a service question and they don't know which department they need to go to. They can call that number and get connected up with the right department, or possibly other governmental and nonprofit resources to help them out. We also rolled out an email, again, a general email for people who have questions, concerns, service inquiries relating to COVID-19 in town, and they don't know where to go. So that email COVID-19@Easton is available as well. We launched a dedicated local website, borrowing the practice from the state of the easton.ma.us/COVID-19. That website now aggregates and serves as a central repository for the significant amount of press releases that we've been pushing out, the guidance we've been pushing out, the state and federal resources we've been making available. So we put everything in one spot. It's a lot of information, but it was spread out over a bunch of different formats, and we put it all in one place to try to help people get what they need. We have expanded the typical contact us section of our municipal website to include an up-to-date listing of ongoing municipal service impacts so that people can go and check and find out exactly how they can get services that they need from various departments. That includes changes in office hours, that includes using technology for inspections, and all of that type of thing. So we're continuing to work. We have services available to the extent we can for the public, and we're doing everything we can to continue to be creative and try to solve those issues and continue to serve while our buildings have to be closed. Public works, water, sewer, trash, construction. Public works and water continue to be operational. They are essential. Whether there's a health emergency or not, infrastructure breaks, it needs to be fixed. The very first day that our buildings were closed to the public, there was a major wastewater, a septic issue at the town offices. It needed to be fixed. It got fixed. These folks have to keep working. They're doing a great job. DPW is fully operational. Essential services such as water, wastewater, trash, and public building disinfecting is continuing to be provided by Public Works and Buildings and Grounds. Construction. So in accordance with the governor's essential services orders, critical infrastructure construction, including for sewer, is allowed to proceed. DPW has implemented mandatory enhanced site safety and health protocols for any vendors that we are continuing to allow to work during the state of emergency. That includes in the 5 corners. And moving forward, Director Field will be reviewing any typical infrastructure service contract that we would have to evaluate on a case-by-case basis which projects must continue and which can be done while adhering to those critically important public health and public safety guidelines to reduce the spread of COVID. Curbside trash, recycling, and textile pickup. So as of March 25th and continuing this, I didn't update this, through today, waste management, trash, and recycling pickup remains uninterrupted. Waste management has asked that we share, and I ask anyone watching this to share, to please remind folks to properly seal and tie off any trash they have. Because again, you know, public works employees, waste haulers, these people are essential to the functioning of day-to-day life, including during stay-at-home times. And to the extent we can limit waste haulers' exposure to trash that may have bodily fluids on it or things like that, please, we really ought to do so. So please make sure you're sealing that trash and trying to take care of their health there. Textile recycling is a program we rolled out, I think, in the past year. Unfortunately, that has been suspended by the vendor until further notice. So with that, I'm going to turn it over to the Director of Health and Community Services, Kristen Kennedy, to just give an update on the public health aspect of our ongoing emergency response.
Thank you, Connor. This is Kristen Kennedy. I'm the Director of Health and Community Services for the town. As Connor mentioned back earlier this month, the Board of Health as well as the Board of Selectmen jointly declared a state of emergency, which allowed us to highlight all of the activities that were going to be needed going forward to help educate and ensure that the public do their part in flattening out the curve. One of the first actions that we took was to suspend play on the fields and play structures that are on a lot of the town properties. Emerging science, and the landscape on this issue is changing by the minute, is showing us that the virus can survive on items such as play structures. So it was important to get out and educate individuals and families and let them know that even though it's a nice day and the kids aren't in school, it's not a day for play dates. It's a day for playing in your own backyard with your own family. We continue to work, as Connor mentioned, the health inspectors have been out in the community doing a lot of educational work. Our nurse continues to do state mandated disease reporting and tracing, and this isn't just limited to COVID. We actually have other reportable illnesses that are on our plate as we're going through this. We are actively, as we are made aware of cases of COVID through the channels that exist, the labs reporting to the state providing us the information. We are then charged with contacting individuals. There have been a number of cases where we're the ones telling people that their test is back positive before their doctor even has a chance to get in touch with them. When we're doing that, we're using a definition to try to identify their contacts. And as you've seen in a number of the press releases, once contacts are identified, they are also contacted and advised of the need for them to quarantine. Going forward, this is why we all doing our part and staying in our own familial groups makes this job a little bit easier. If I were to call anyone up today and say, okay, you got sick 3 or 4 days ago, and who were you in contact with 2 days before that? The hope is, with all of these restrictions in place, that it would just be the members that are in your immediate household. And that makes containing the contacts and identifying the contacts a lot easier. Just for everybody's information, a contact is defined right now by the state by anyone who has spent more than 15 minutes within a 6-foot radius of someone who tests positive for COVID. This isn't anybody you're passing on a street corner while you're out walking the dog. These are people that you're actually staying and hanging around with and speaking to for any length of time. That's why we keep repeating the same messages over and over again. We've been fortunate that we have been able to utilize some of the school nurses to help us with this contact tracing, and this is going to become even more important as we start to approach the surge. Right now we have a manageable number of cases with 3 or 4 people spending the better part of their day doing this, but this is going to become an even harder task as we go forward. We have been continually working on public messaging and getting information out there. As Connor mentioned, we got the website up and rolling, and we're constantly adding to that as we find new information that makes it easier for people to understand what's going on. We did publish on that website also as an FAQ, answers a lot of questions that we were getting in the first couple weeks of this. The department as a whole is out doing as much as it can, again, just to educate and make sure that people are understanding what's expected of them, and our businesses what's expected of them. This week, our health inspectors spent time going to the grocery stores and the pharmacies and making sure that they were in compliance with the gubernatorial distancing orders and orders for wipes to be there to wipe the grocery carts down and other things that will protect people as they're out doing things that are absolutely necessary. As I mentioned, the nurses are helping us with case management. We're continuing to monitor our vulnerable populations and our rehabilitation facilities. Education and advocacy are probably the biggest thing that we are focused on right now besides tracking cases. We have been supporting the town administration in developing protocols for town personnel. We're a constant resource for people here. Our outreach coordinator and our health inspectors worked very early on in this process with the food pantry to ensure that that critical service could continue to function with adaptations that have ensured and put controls in to ensure the public safety. as we go through this, it's very uncomfortable for a lot of people. We're not used to being in our homes and only talking to ourselves. It's inconvenient, it's uncomfortable, but we all need to work together to ensure that these actions that we're all taking now, as uncomfortable as they are, will help in the long run to help us flatten the curve on this. The rest of Health and Community Services, not just the Board of Health, are also deeply involved in this. Our outreach coordinator, our veteran service officer, our administrative help are actively involved in manning that email address, that phone line, and to maintaining list of resources that can be utilized for people that are going through difficult times. And I encourage anybody out there looking for a resource to reach out to us if we don't have the answer. My staff loves a challenge, and they will try to find a resource to help with whatever you need help with.
Okay, thank you so much, Kristen. I really appreciate that update, and I'm sure the community has been asking a lot of those questions, so it's very helpful. Next, Chief Partridge, if you would like to talk us through some of the public safety issues.
Hi, good afternoon. I'd be glad to, Dottie. Kevin Partridge, Fire Chief, Emergency Management Director. And as you heard mentioned, this is not the typical public safety emergency that we're used to dealing with, snowstorms and hurricanes. So it's presented us with some challenges, but I can assure you that your police department, fire department, dispatch is fully operational. We are responding to and handling calls as normal. And in addition, we're handling the COVID-19 related cases. Some of the initiatives we put in place are unified protocols between the three departments to establish providing medical service to people who have COVID-related symptoms. So dealing with patient transport, inter-department data sharing, so that way first responders are aware if they're going to a facility that we have the information prior to arrival that people have symptoms and could possibly be infected with the COVID virus. It's important so that way our personnel are taking the appropriate steps to keep themselves protected. We have also put in place a unified plan to test public safety first responders if we need to, if any of them are exposed on a call, or if they come to work with symptoms. We have put in place a daily health screening for all our personnel, taking temperatures and asking certain questions regarding how the employee is feeling. So that way we can avoid allowing anybody who has the onset of symptoms from going to work. Daily disinfecting of all the buildings, as you heard, is ongoing. And we also have additional supplies, both for police and fire, to disinfect all our equipment that we may bring into a house, and also our vehicles after the call is over. And the DPW has been a great partner in that, in deconning all the town buildings, including the public safety buildings, and our apparatus. To the extent possible, we as well are trying to maximize the social distancing from people. So we've been encouraging our people when they're at work to maintain that social distance, keep their hands washed. Obviously, we're deconning everything with sanitizer, but also when they leave and they go home, to go home, to not be out socializing and try to keep a social distance, so that way they're keeping their family protected, but then also their work family, because we rely on the workforce to continue to be able to provide the service both on the police and fire and dispatch. We've locked the buildings down, so the fire stations are closed, but you can go online or call the stations if you have any questions, information that you're looking for. The police department lobby remains open, so for emergency purposes, residents can go into the police department lobby and the dispatcher will assist them. There is a glass separating the dispatchers from the public lobby. We continue to permitting and other administrative services remotely by phone or online. We're doing minimal inspections, any outdoor inspections that can be accomplished. We are handling those on a case-by-case basis. We will do a vacant a new construction home that's vacant, nobody on the premises. We will take those on a case-by-case basis. We have been working diligently to maintain our PPE supplies. We put in place numerous policies regarding the PPE that our EMTs and firefighters need to be wearing on every call, and also the police officers. So as you've heard, both nationally and statewide, PPE supplies are in short and limited supply, but we continue to get some donations. We have several vendors that are trying to keep us supplied as much as possible when they get some. As you heard, the Patriots team, the Crafts, secured a huge amount of N95 masks. So I was told today that we could expect to see some of those this weekend or early Monday. And again, on the request to the state, we have had our request in for at least 3 weeks, most likely 4 now, for additional supplies to make sure we're keeping our personnel protected. We're facing the same issues of trying to get supplies, just as many other public safety agencies, states, and the federal government are. I want to thank the area businesses that have supported us, individuals that have donated supplies to us. The school department was very supportive. They had, with all the schools being closed, they had certain supplies in the nurse's office, science labs, that they were able to donate to us, that we're utilizing across the 3 major departments, police, fire, and DPW. Anybody that does have PPE that they would like to donate, you can donate it to 413 Bay Road or call the fire department, 508-230-0750. We'd appreciate any support you can with hand sanitizer, disinfectant supplies, masks as well. Again, we thank everybody for helping us out. Please stay home. That's how we're going to defeat this thing, is to limit the exposure from person to person. That's how we're going to stop COVID-19, flatten the curve. And that's going to, in turn, keep our first responders healthy, keep all the healthcare workers healthy, and keep people out of the hospital. Thank you.
Thank you, Chief. What I want to do now before we go into the next discussion and vote is just take a minute to go through our roll call. So I'm going to ask Craig first, and then Tom, and then Mark, if you have any comments or questions on anything we've talked about so far. So Craig, if you have anything.
The only thing that I have is how impressed I am with the quality of work that our first responders, our health service people, Kristen, Chief, DPW, police have done thus far and will continue to do. And I think the community needs to know what a great job everybody's been doing. Connor, you and Michael are included in that.
Thank you. Tom, any comments?
Yeah, very well said. Very well said, Craig. I appreciate that. The only thing that I could possibly add, because words just seem not to cover the amount of effort that you all have put in keeping the residents in our community safe. But in times of our greatest challenge, those you folks are certainly shining the brightest, and I can't express my appreciation enough. And that extends to everybody, all of your teams that have done such a great job. So thank you very much.
Mark, you want to unmute yourself and comment?
Okay, how you doing? Echo what everybody else said. you guys are doing all the heavy lifting, especially my concern lies a lot with those guys in the front line, the Chiefs guys. And he talked about it a little bit earlier, but exposure for the first responders, paramedics, officers, those guys. And a question came into my mind: what actually constitutes exposure for those guys? I want to ensure that, and I know Chief is doing it, and we're all doing it. You guys are all doing a fantastic job, but I want to ensure that they. I just want to know what exposure is, as defined by us, because we can't afford to lose guys in the next week or two. My fear is that if they're exposed and we're down 2 men going into next week, so what is exposure?
So I've been saying, based on the policies that we put in place, the PPE that we have on hand, it's more likely that our people are going to get exposed outside than they are at work if they're following the procedures. We did put some thorough procedures in place where they wear gowns, gloves, eye protection, N95 mask. The patient gets a surgical mask as well. We limit the amount of contact. So in most cases, we're only sending one paramedic in to assess. And if the patient is able to walk, the dispatchers are telling them to meet them at the door, where we can have a conversation with them, assess what's going on. If they're capable of walking, we walk them out to the ambulance and get them in the ambulance with all the PPE on. We don't expose the other members who respond on the call unless it's necessary, although they do have gloves and will have a surgical mask on at the minimum. So if they're following the proper PPE protocols, the exposure risk is minimal for somebody that is symptomatic with COVID. And in most cases, we probably transported over 20 patients with symptoms of the COVID virus, and we've had no exposures on any of those calls. So we do assess every call where we do feel that there's a possibility of COVID-19. So if they're symptomatic, if they have family members that have it, if they were exposed and they're on quarantine and start to get sick, our infection control officer reviews every one of those calls. He has a consultation with Dr. Crowley, who's our service medical director, and they make a determination. He speaks to each individual who's on the call, asks them exactly what they were wearing to make sure they had their proper PPE on. If for some reason they hadn't and accidentally got exposed, then we would take action regarding that person that was exposed. We do get notified by the hospital. If somebody tests positive, the hospital is immediately calling our infection control officer, and he then does the review of the call and all the members who were on the call. So I'm very happy to say our people have been doing a great job, and we've had none exposed to this point.
It sounds like you guys are doing an amazing job, and I trust in your leadership. I trust in Chris and your leadership, and please keep it up. Thank you.
Thank you. And just a reminder to people that are watching this, if you do have questions, we are updating the town's website, www.easton.ma.us, every day around 6 o'clock. The numbers of current cases will be updated, and any current updates on the state or local level will be there as well. So make sure to check back. I also want to thank the people that are attending the call. We do have one comment from Peter J. Wiggins, who I know as the honorary mayor of Norton, and he says, "Thank you to Chief Partridge for doing a great job of keeping Easton safe during COVID-19. So thank you for that great comment, Peter. I'm going to go next onto the agenda is a discussion and vote of rescheduling the annual town election from April 28th to June at a date to be determined or discussed. So Connor, if you want to give us a little bit of information about that.
Sure. And just before we get fully into that item, we do have just two other things that I wanted to note as far as our ongoing response on the prior item. Is that okay? Okay. So one of the transitions into the next topic was identifying the key legislative action that's happening on the state level. The Commonwealth continues to try to support municipal governments, working with the Massachusetts Municipal Association to amend and enact various laws to support us with things such as postponement of elections, town meetings, tolling permit deadlines, thinking of emergency budget provisions, and for deficit spending for COVID. So those are all important things. We're going to touch on a couple of them in the next item. I do have to take the opportunity to just give the board an update on the little information we do have regarding the financial impact of this crisis. So regionally and nationally, there's a tremendous amount of financial uncertainty right now. The Commonwealth of Massachusetts is projecting a multi-billion-dollar revenue shortfall next year, roughly equivalent to 5% of their annual state budget, which will almost certainly have ramifications on cities and towns who rely on state revenue for education and other critical funding. As of yesterday, more than 10 million Americans had lost their jobs in 2 weeks. The hope from some economists is that those losses will not be permanent and that some of those jobs will come back after the social distancing is relaxed, perhaps months from now. But for perspective, that's more jobs lost in 2 weeks than during the entirety of the Great Recession from December of 2007 to January of 2010. St. Louis Fed is estimating that national unemployment could hit 32%. Again, for perspective, during the Great Recession, the peak unemployment was 10%, and during the Great Depression, it was about 25%. Municipal bond markets are in turmoil right now, which will challenge not just Easton, but any municipal government's ability to issue bonds and bans, which, as you know, are critical for financing capital projects. So there's a lot changing and very little that appears to be changing in a positive direction for next year. And so what we know right now in the local impacts that this economic uncertainty has created so far, we, under the governor's emergency orders, immediately sought, and we've received authorization from the Department of Revenue to do any necessary deficit spending relating to COVID-19. That includes for emergency procurement of N95s and other supplies and materials that are critical to our first responders' abilities to respond to this crisis. We have implemented a spending and non-emergency personnel hiring freeze across the town government. Looking into next year, fiscal 21, the budget for that, the preliminary budget we issued in February, was already looking at a really challenging year to create a balanced budget without cutting services. And because of the projected revenue shortfalls on the state level, the national economic malaise, that preliminary budget basically needs to be started over from scratch. The assumptions underpinning those revenue estimates are no longer relevant. So the finance team, led by Wendy Nightingale and I, we're already working on that. We are tracking March actuals on a local level to look at the impact on permits, on collections and things like that. But even March actuals will not be fully illustrative of the problems we're going to face, because much like the national unemployment rate that came out today, those numbers will be partially insulated from the impacts we're seeing today, because most of the more severe social distancing measures were only implemented about halfway through the month. So we'll learn more in March, we'll learn a lot more in April. We expect to get some ballpark estimates from the Commonwealth next week on what the impact to municipal and educational finance will be. But we should be bracing ourselves for bad news. Fiscal 21 will almost certainly be the hardest year financially for us since the 2008 recession, and potentially worse. Severe service cuts are likely to be unavoidable. We're doing everything we can right now to get as much information as we can and start preparing. We've instituted spending and hiring freezes. We rolled out our incentive plans for employee insurance to encourage folks to continue taking more cost-effective plans or to opt out of insurance entirely if they have somewhere else they can get it, to try to put effort in every single area that we can to reduce spending now to hedge against what is going to be an incredibly difficult year. So Dottie, that I will keep the select board and finance committee in the loop, but I would expect it will take weeks before we have enough information to even revise our budgets. But we'll be working on that around the clock, and we'll keep everyone informed.
Thank you very much. So now we will go on to the discussion and the possible vote about the town election.
Hi.
Danielle.
Hi, this is Danielle Sicard. I'm the town clerk. As you're aware, on March 23rd, the governor signed into law Chapter 45 of the Acts of 2020, which is an act authorizing the ability to postpone the 2020 municipal elections in the Commonwealth. It also provides for increasing voting options in response to the declaration of emergency in response to the COVID-19. Some of the key points of the legislation include the following: establishing a new voter registration deadline. That new voter registration deadline would be 10 days prior to the rescheduled date. It would also authorize the town to reuse the current election materials. We will not have to spend additional funds or change anything. All of the materials will still have the original April 28th date on it. And in light of the widespread practice of social distancing, the law also provides for two alternatives to voting in person as our offices are closed. The first is establishing any person who's taking precautions related to the COVID-19 will qualify for absentee voting. Second, the law provides for early voting by mail. So this essentially is a no excuse absentee voting by mail. The act specifically provides that an incumbent elected official whose term would have expired at the annual town election shall continue to serve in the official capacity until the new election date. And the law does not change any of the candidate deadlines. So our ballot is finalized with our candidate deadlines as it is currently. After the town votes to postpone the election, the law will require us to post a public notice on the new date. It'll be on our website. Such notice should also include a copy of the act that went into law, and also a copy of the select board's vote, and also a copy of a sample ballot. We're also required to do a broadly publicize this postponement, and we're going to do that beyond just the website, and including resources such as the town crier, our social media platforms, our local cable channel, and also some press releases to our local news medias. So that's pretty much the overview on what we're permitted to do in regards to changing our date.
And do you have a recommendation on the date for that, Danielle?
Seeing we can postpone all the way up until June 30th currently under this legislation. And so I think that what we should do is err on the side of caution and look towards the latest dates that we possibly can in that window. And so my recommendation would probably be to do Saturday, June 27th. We also have the ability under Mass General Law 54, Section 64, at a local election to only have our election open to the public for a minimum of 4 hours. In that case, we would need to open no later than noon and close no later than 8 p.m. So I think if we do a heavy push on early voting by mail and get the word out that anybody who might be interested in voting should apply, and they should apply now. Quite frankly, they don't have to return their ballot if they don't want to, but if you think you might want to, I would recommend applying now. Then we won't have as many people who will attend the 4-hour window on election day. So my recommendation would be to look at June 27th for a 4-hour window.
Okay, Great. Craig, do you have any comments on that?
I have a question about why in particular were you looking at a Saturday?
This is Danielle again. Sorry, we could do the 30th, which is a Tuesday. My thoughts around that is if we're going to limit it to a 4-hour window, that Saturdays tend to be the better day for people. And so if we're in the clear, social distancing isn't a problem for us at that point, then the Saturday date would give more opportunity for those people to come in. Again, I don't know that we're going to be all set by either one of these dates, to be honest. I think the main point to this is that we need to market and tell people this legislation provided us with early voting by mail for a reason. And we should really be asking everybody who possibly can to vote by that way, keep themselves safe and keep our election officials safe by letting us manage the ballots that you do by mail as opposed to additional people coming into our facilities. So that's essentially why I'm saying that date. If you were not looking at a Saturday, then I would probably recommend the Tuesday, June 30th date.
I would say that having it on hopefully by then people are going to be back to work, and I think that everybody's going to be eager to get back to work. So I think a Saturday would probably be a great day to get people out. But I agree that doing a real push to have people take advantage of the voting by mail will really help facilitate this. Craig, did you have anything else?
No, I just think that voting by mail, voting absentee ballot would be a very safe way to do it, a very convenient way to do it. And I'm sure that Danielle's office will put out all the details as to specifically how you go about doing that, so you don't have to come into town hall or anything like that.
Tom, comments, questions?
I think it's well thought out. The only thing I might recommend or ask Danielle is whether or not the opportunity exists to go a bit longer instead of 4 hours to 6. And in doing so, provide the opportunity for people to spread out their engagement in the voting process so it avoids critical masses of people that, again, I hope are very small because everybody has done mail-in. But if we went a little bit longer and provided guidance, I know we can't provide definitive, we can't tell them definitively what to do, but if we provided guidance about when people should plan on showing up, perhaps by first letter of last name, for example, would that control the amount of people that would flow through a voting area and therefore limit the potential exposure that may still linger in our population even after the all clear? And that's just a thought that could potentially be noodled, not just today, but maybe going forward, is part of, as we get back to normal, I think I think that COVID will still be here for a certain, to a certain degree potentially. And I'm just thinking whether or not we can expand that or should consider that. There's probably other considerations like the incremental cost that goes with a longer session, but I'd personally be willing to bear that incremental cost if it increased the safety of the people at the polls and the people going to the polls.
Go ahead, Danielle.
So to answer the question, it's a minimum the 4 hours. It's just a recommendation. You could certainly go to 6 hours. I am currently working on a kind of a reorg plan on how we would do this anyways. Similar to grocery stores, there'll be X's and dots and quarters of stanchions so that people will only be 6 feet away from each other, and that will happen either way. So whether we have an influx of people, at the beginning of the day, which is typical no matter what we do, or at the end of the day, or at lunch hours, we're going to have to come up with plans to make sure that we're doing this as safely as we possibly can. We'll work with the DPW and having plexiglass at our check-ins. How do we give pens to voters that will be read by the tabulators, but are not contaminated by other voters? Those are all things that we're dealing with and we're working on. And certainly between now and our election date, we would have a solid plan for that. So
great.
Hey, Mark, any comments, questions?
No comments or questions.
Connor, do we have to have the hours scheduled for the motion for this? today? We do.
Mhm.
So Danielle, what are your thoughts? I mean, I really would go with your best judgment on how you set this up for whether it's 4 hours or 6 hours. I feel like I'm inclined to feel 4 hours will really focus on it. And if you're saying, you know, if there were crowds, they would have to be standing apart out in the parking lot in lines to get in. But again, if we do a really good push and encourage people to do this by mail, we shouldn't have a problem with that. I think the less amount of time that we expose our poll workers to, the better. But that's just my thoughts. So I really want to defer to your recommendation.
So, you know, the election community, town clerks, we're all struggling with the same thing. You know, do we do the 6 hours and hope that those 2 additional hours actually spread out more people versus the 4 hours? A start time, are you so inclined to go with a Saturday date? Because that's the start and end times would also depend upon that.
I would prefer a Saturday date. What about Craig, Tom, and Mark? If we could just.
This is Craig. I have no issue with Saturday. We did that once before, as I recall.
You did.
Yep. This is Tom. I also would agree with the Saturday date.
This is Mark. I would also agree with the Saturday date.
So my recommendation would be either 10 to 2 or 12 to 4 for a 4-hour window. And if you would prefer to have 6 hours to add, you know, them on the other end.
I'd prefer 6 hours, and 10 to 4 seems appropriate.
I would also prefer the 6 hours from 10 to 4.
Well, I guess I'll make it unanimous that I think the 10 to 4, 6 hours would make the most sense.
All right, looks like it will be 10 to 4. So, and the date would be June 27th. Any other comments or questions on this from anyone? Connor?
No, just to reinforce that we'll work with Danielle in Public Works to maximize the public health there with spreading folks out, plexiglass, things like that to the extent we can. I think even optimistically, to Tom's point, we are still going to be dealing with this in June.
Okay.
So Dottie,
Yeah.
just excuse me, but to Connor's point, at what point prior to the June 27th date, if the governor continues to declare a state of emergency, how soon do we need to know that, or what's our process if that were to happen?
Danielle?
Sure. This is Danielle. My guess is that if we are getting closer to the June 30th date where the acts, Chapter 45 Acts of 2020 provide that they'll extend that, and we are going to know in enough time. So I think it's good to think ahead, but having the ability locally to limit the number of hours, I think is where they're honing in on for us. So I do think that if we get closer to the date, further legislation will probably go forth to extend that. And my guess is that, some town clerks are having theirs in May. There's a special state election on May 19th. We have a special state election on June 2nd. These are state elections that we can't minimize the hours. That's a state regulation right now that will require a 13-hour election day. As we approach each of those days, I'm following with our legislative agent, I'm seeing what's happening, and certainly would provide Connor and yourself with recommendations on what we should do to move in a legislative way, should we need to.
Thank you.
So I know that one of the questions will come up, why can't we do it on the same day? Can you talk a little bit about that, Danielle?
Sure, we certainly could do that on the same day. And that's one of the things that I think, we talked about in advance. It's just so close, and it does require the 13 hours and I think that something's going to change on that date, to be honest. I don't know that it will, but the way things are going, I'm feeling like there's going to have to be a further legislation and things to do. luckily, we're on the second wave of that. The May 19th group is going to go first, and we're going to kind of take and watch and see what they do. If they petition the legislation or court to reduce the number of hours, because it's mandated right now by the state to be 13 hours. So we'll have a little bit of time after that May 19th date to kind of decide what we're going to do. And it's a volatile situation. Why not take a proactive approach of saying, let's do our local elections separately? Another thing to think about is the local election that's, is all 6 precincts. The special election on June 2nd is only for precinct 6 voters. And we have already, you folks already voted to have that election be at the town offices. And so anytime we change a polling location for voters, notification to each of those voters' households is required. And so we're, again, going to monitor that closely and see what happens as we approach the June 2nd date and where we're at as far as town offices being opened. So I thought it was better to stay away from that date for all of those reasons.
Any comments or questions from the board? Okay, I do have a motion drafted for this, and so I'll read that. Pursuant to Chapter 45 of the Acts of 2020, an act granting authority to postpone 2020 municipal election in the Commonwealth of Massachusetts and increase voting options in response to the declaration of emergency to respond to COVID-19, the board votes to postpone the town election currently scheduled for Tuesday, April 28th, 2020, to be held on Saturday, June 27th at Oliver Ames High School from 10 a.m. to 4 p.m. and in order to keep voters and election officials safe, to advise voters of the ability to take advantage of the early voting by mail option that was created by this emergency law. If someone would like to make the to move that and to second.
So moved.
Greg Barger, I move to that motion.
This
Mark
is
Lane,
Tom
second.
Broussard. Yeah.
Oh, Craig made the motion. Tom, are you seconding?
Sure, yes. Tom Broussard, second.
Okay, we'll take a roll call vote in the order of Craig, Tom, Mark, and myself. Craig?
Greg Barger, yes.
Tom Broussard, yes.
Mark Lamb, yes.
And Dottie Fulgenetti, yes. Danielle?
Thank you. If I could just take 1 minute more of some airtime, hoping that people are already paying attention and listening to this meeting. Just a few things for the voters to kind of keep in mind. First of all, if you've already have requested for an absentee ballot, no matter what the date is, you don't have to reapply. That ballot and that application is the same one and will automatically be counted at the right date of whenever the election is. I can't stress enough to allow enough time to apply early. I know we're talking about a June date, but why not now if you're thinking about applying or voting in this election to apply now? We have the ballots. We can start mailing the ballots out next week. They will all say absentee, whether it's an early voting application or not. Remember, we're on reduced time in the office, and everything election related requires us to be in the office, and we're relying on the mail service. So we ask voters to know to apply early and also to give it at least a week after applying to get your ballot. We're accepting email applications, and it's actually the way we would recommend it. You can find the applications on our website in several different locations. Under the department's town clerk's office, election information is a whole section on absentee voting. Also, as Connor had mentioned earlier, on the town's website under residents, about Easton, and contacting us, you can find a full link of all of the services for the town clerk's office and how you can access them, including the absentee ballot links. If you have any questions whatsoever, email townclerkswithanos@easton.ma.us. We can email you. We already have kind of a template put together to email you all of the links that you would need in order to get this application. Applications don't require a scanner. You can take a picture of it. What it requires is a signature. I need to know what you're applying for, and I need to know the signature. So I'd rather our staff to be inundated over the next month in order to provide 1,400 ballots as opposed to waiting till the last week. The process will take more than a week. So thank you very much for the airtime on that.
Thank you. We appreciate that, and I hope people will take advantage of it. Okay, the next up is to talk about our annual town meeting. Connor?
Sure. So I'm actually going to turn it over to Jay in one moment to just give a brief summary of the legislation I think was signed right as this meeting was beginning. That is going to create the opportunity for cities or for towns to postpone town meeting. We need to do more logistics planning in order to pick the best date, because again, that legislation was signed as this meeting started today. But we should take the opportunity to have a conversation about that. And I'm going to ask Jay to just give a summary of the relevant bits of this legislation that was just signed. Jay?
So the Jay Tallerman, Town Council. So the existing legislation that exists today and has always existed would always allow the Board of Selectmen or the Select Board to postpone a town meeting, regardless of a charter or bylaw provision, to any date, even after the warrant is posted, to any date before June 30th. The new legislation that was passed just about an hour ago that's been being discussed, that has been discussed for the last weeks, would allow you to go beyond June 30th if you so desired. A lot of towns are staying within that June 30th window, but a few find this proposal particularly interesting. It's married to other provisions in this new bill that address how you would adopt a budget, an interim budget, between June 30th and when you actually have your town meeting. Essentially, it's a 1/12 budget that is based on last year plus additional monies as may be set forth in a plan adopted by the Select Board. So those are, and then there's some other financial procedures as well that would allow some interim use of other funds and some amortization of deficits and immediate use of free cash and recertification of the amounts of revolving funds and this and that. So you have the authority to go to June 30th already before the governor signed this, and now you have the authority to go beyond June 30th. A couple of notes are important. The original statute that was proposed had 2 months to it. Now it seems to be kind of more wide open. The original version also waived upon a vote of the Select Board quorum requirements for your town meeting. That did not make it into the final version. That is a significant spot of concern for a lot of towns I represent, and we're probably going to be going to court in some of those towns that have high quorum requirements just to get that waived so that we can hold town meetings. So those things are, that's the highlights of it. So you have pretty good range of options moving forward.
So I don't know that we're, today in a position to pick a date or to describe the details of that, but I think maybe we could get a consensus from the board that we do want to push our town meeting out. And then Connor, you could work on some of the logistics of that. Is that reasonable?
Yes.
How do the other board members feel? Craig, you want to?
I think it's very similar to the date for the town election or for the special election. It's if you put a whole bunch of people into a room and you risk exposure. So it would seem to me that assuming that we would get a decent turnout for a town meeting, that we should probably consider going beyond July 1. Although I agree that we maybe should wait to make that decision based on circumstances around this COVID crisis going forward before we make that ultimate decision.
Tom, your thoughts?
Agreed. Well said, Craig.
Mark?
I agree with Craig's sentiments. I think historically, every town meeting has been about 2 weeks after the election. So I don't know why we wouldn't hinge it to the election, whatever date that is, make it 2 weeks beyond that or thereabouts. So right now we're at June 27th for the election. So, I mean, we don't have to set it in stone now, but just keep an eye out for a date in mid-July for town meeting.
Connor?
And if the election moves, then town meeting moves, the same space between as it was set up.
So my only feedback on the time between the town election and town meeting is that those are prescribed in our charter, but there are certain significant ramifications for us as an organization if we do not have town meeting or some other legislative relief allowing the adoption of a budget. So if we were to move town meeting into July or August, we would have no budget in place for July 1 outside of the what's called the 1/12 budget with some exceptions that Jay just noted. That would functionally have the effect of having a 0% budget, which, depending on how bad revenue is, might be the case anyway. But I have one question, Jay. If the board postponed until, say, June 20 or June 30th, does this legislation allow them to do additional postponements if assessing the health crisis it's May or June and it's not improved? Can they then postpone that further?
I read that to be the case. I don't see a barrier on that, Connor. And the moderator would also have authority at that point as well to do that. On the 1/12 budget, though, I think one thing that they have done for us is when you and I originally began discussing this, and because it was floated that we could go beyond the July 1st, the original governor's draft of this bill just said a 1/12 budget based upon the prior year. That would be really harmful to services. Now it says, it's evolved a little, and it says not less than 1/12 of the prior year fiscal budget. And the select board can come up with a plan for how much more than the 1/12 it would be. That plan is subject to review and approval by DOR, but we don't have any reason to believe that they're not going to approve anything that's a reasonable basic increase to account for your steps, your contracts, your increase in fixed costs, your healthcare, other things like that happen year over year. So there is some things built in here. It does create a bit more work because you're essentially creating a contract, a budget, and then hoping DOR puts it together. And then there'll be another budget adopted at the town meeting in a more traditional legislative method. So there is some relief there, but it certainly will be a unique situation. We go through this sometimes with the schools, the regional schools, where regional school budgets fail and they end up in a 1/12 budget situation. Those can be tricky to navigate.
So that's helpful, and that's actually feedback that we specifically, working with you, provided to the Commonwealth while they were writing this legislation for that exact reason. So it's good that that made it in there. That's really important, and it gives us an additional release valve to pull on in case there's still a complete health crisis going on at the time. So,
well, I would say not only am I concerned about, as Craig mentioned, having a big crowd of people when we're not sure when we're going to have relief from the virus, but also you had said earlier the big shortfall in money from the state. They're going to have to do their budget, and that really is going to be a big determination. If they don't do their budget until well late into the game, it's really going to be tough for us. And I also would want to talk with the moderator beforehand to make sure that we're all on the same page with this. Certainly don't want to take a vote on this right now without having her thoughts and recommendations on that as well.
Right. Yeah, it's a really important point, Dottie, that even if in the optimistic circumstance, the pandemic is somehow under control in 8 weeks, our financial planning, we may as well take the preliminary budget that we have and shred it. Frankly, we need to start over. So that will take time.
So I think we have a consensus that we all agree that we'll have some type of a delay in one way or another, and we can just move this forward to a future agenda to pick a date on it.
Dottie, this is Craig. So Connor, does that mean that you would still continue to be working on some worst case scenario budget, if you will, because you don't know what the state is going to actually come up with, and that we don't know what the actual fallout from this crisis will be, vis-a-vis the $1 billion that is being thrown around as potential lost revenue next year?
Yes, we're doing that actively right now. Wendy and I are already working on doing multiple different 1, 2, and 3 year forecasts, assuming the few different scenarios that folks who are a lot smarter about macroeconomics than I am have put out there, including the kind of optimistic scenario that this is a precipitous and brutal recession, but it's short, and the recovery and growth comes back after a couple of quarters. Even in that best case scenario, fiscal 21 is going to be incredibly difficult. But so that's one scenario. And then the other two scenarios are basically, is it a 1 year, 2 year, or 3 year economic crisis? Because those are all not out of the question. And if we look back to the Great Recession, cuts to revenue to cities and towns did not just happen once during the kind of falling portion of the recession. They happened multiple times over multiple years. And unfortunately, I think we need to prepare ourselves for that reality. And so I am working on that right now, Craig, with Wendy, and we are pulling together as much information as we can. We hope to have some more information from the state next week. By next week, we should be able to have a look at our own local collections through March. But again, March figures are not going to tell the whole story. It's going to take us April and May and possibly longer to really have a solid plan based on the revenue information we have at that time. So those are really long-winded way of saying, yes, we're working on it actively right now, and we will go from there to basically starting the process over when we have those slides where, when I'm presenting a budget in February to the public, that is after we have already been working diligently on it since October or November, doing the internal revenue estimates, looking at broader economic trends, meeting with departments to look at their expense requests, trimming those up to get a preliminary budget. So we don't have 6 months here. So we're going to expedite everything to the extent we can and make the best informed decisions that we can. But we are basically starting over.
Do you anticipate word on the CARE Act in terms of the amount of money that will be coming to Massachusetts from this act? I heard figures of almost $3 billion, but I don't know what that's specifically allocated for.
That is one of the things that the state is working on discerning. That has not. There was a portion of the $2 trillion federal stimulus package that identified funding for city and state governments in the United States, but we do not yet know what that looks like for the Commonwealth, and from there, what that looks like for cities and towns. So we're keeping an eye on that and working with the Commonwealth to get that information as soon as it's available, but we don't have specifics yet. No.
Thank you, Connor.
Thank you.
Mark?
No comments.
All right. Thank you very much, Danielle and Jay. We really appreciate the updates on that. Next, we have town administrator notes. As at our last meeting, we voted to give Connor the authority to make purchases and, anything emergency through this period. And he would report to us if anything happened in that period. So Connor, if you just want to update us on that.
Sure. So very little outside of one change order for the sewer project that I executed. I have to pull up the details of it now, but it was relatively perfunctory. The board actually already received the proposed change order. It was on your agenda for March 16th, but it was tabled at that time just because we were reacting to the emergency, and you were only adopting the declaration of emergency and a resolution. So it's a change order just to ensure the water works part of that job is being done in lockstep with the sewer. It was within the budget for the project and does not have a upward impact on the estimated betterments. It had been reviewed by Dave Field and recommended by Dave Field. Finance Director Nightingale had certified that the funds are available for it. I'm just trying to pull up the packet from last week on my phone. If you give me 1 minute, I can give the exact dollar amount. But that is it. That is the only contract executed that normally would be done by the board. There's been other more, routine things that I have the authority to do part of my normal job under the charter. But that was it. I'm sorry if, Dottie, could I just have 2 moments to try and find that packet from 2 weeks ago to give you the dollars and cents?
Absolutely. We could look at the minutes right now if
You're right.
why don't we do that while Connor's looking? We have minutes of February 10th, February 24th, March 6th, March 16th, and March 20th. So we did have, I believe, one typographical error in the February 24th minutes. So if somebody would like to make a motion to accept these minutes, and we could do them all together, noting that we're accepting the February 24th minutes as amended.
Craig Barger moves to accept all the minutes.
Tom Broussard seconds that.
And a roll call vote.
Barger, yeah.
Broussard, yes.
Lamb, yes.
Full Janetti, yes. Connor has left the building.
I'm still here.
Do you have, are you ready to talk about that now? Or?
Yes. So the change order was for 460,000. Sorry, just $460,910. This was for additional work for the project and in response to some additional work. Some of the work that would have been part of the Depot Street water main project has been moved to this project because, as you may know, we're already in a part of Depot Street for a sewer, so we're just reallocating those resources there. Parts of a water project are through water enterprise, not betterment funded.
If I recall correctly, Connor, this prevents having to dig up the same exact area of road twice.
Correct.
Yeah, it makes perfect sense.
Okay, great.
A copy of that was filed with you as well. So if anyone doesn't have any more questions, that was all for me.
Okay, before we go, I'll ask each member of the board for their final comments, but I just wanted to ask Michael, have we received any email questions from anyone that we should address, or?
Hi, Dottie, this is Michael Blanchard. No, there have been no questions received via email as of now.
Okay. And I don't show any open questions on the Q&A from the public here, but we do have some attendees. So I do want to thank you for taking the time to join the call today. And I'm just going to go through the board members. Or Connor, did you have any final comments before we did that?
Sure. The one and most important thing I did not say during my update is thank you to the public for their patience as we do everything we can locally to respond to this crisis. Thank you to the board for your support of me and my staff. And also, of course, thank you to the everyone involved in EMA, the chiefs, Dave Field, Kristen, Mike, our public health nurse. Everyone is really, in some senses, literally working around the clock right now to do our best to try to flatten the curve. And they've just been remarkably dedicated and impressive, and I'm very, very proud of them, and hope that we can continue doing as good of a job as possible with circumstances none of us have ever worked through before. So thank you to everyone for your continued patience and compassion with each other.
Great, thank you. Craig?
I want to echo what Connor said, that I'm impressed with the folks in town and how they've responded, and particularly want to thank Connor and his staff and the first responders for the terrific job that they're doing. I want to thank everybody, and hopefully we get to flatten this curve and a lot sooner than we fear.
Terrific. Tom?
I just want to say it was really nice to see everybody. It's been a while, and I think that's part of what gets missed with everything that's going on. And I think it's important to continue to maintain those social connections. Certainly expressing my appreciation for everything that all of you folks do on behalf of our community. It is incredibly impressive and humbling to be a very small, minor part of a team like this, and watching you folks go out and execute successfully in doing all that you do. I do also want to thank the residents of our community. I've noted that Massachusetts is a state that leads in trying to practice social distancing and being safe. And I applaud Easton, not only this team, but also its residents for adhering to that. And definitely, I encourage everybody to continue to keep those social interactions. It has been impressive to see the Zoom meetings that teachers are holding. It has been impressive to see the letters come in from, or emails come in from friends to my children's accounts and vice versa. And it speaks to the adaptability, I think, of the residents of our community to continue to try to be at their best during this time. So again, great to see everybody, and thank you all very much for all that you do.
Great. Mark?
Thank you, Connor. Thank you, department heads. Thank you, everybody out there on the front line. I think by now we all realize this is a marathon and not a sprint. And please just keep it up, and thank you.
Great. I would just say over the past couple of weeks, I've seen such incredible teamwork by Connor and our department heads and our board. I've also seen wonderful examples of community spirit. Businesses are offering takeout food. The food pantry is providing food and essentials to those in need. And people are finding ways to work remotely, teach their children, all while trying to keep some semblance of normalcy. I know for myself, some days are easier than others, and some days it's really just hard. So I'd encourage people to pick up the phone and check in on your friends and loved ones. Hearing your voice might just be the thing that helps somebody that day. We need to support each other and cheer each other on. The next 2 weeks are going to be a real challenge, and I'm just asking everybody again, please stay home. We can do this, and I wish you all good health in mind, body, and spirit. I'll take a motion to adjourn, and thank you everyone for being on the call today.
Greg Barger, so moved.
Broussard, second.
All in favor, roll call.
Barger, yes.
Broussard, yes.
Lamb, yes.
Full Janetti, yes. Thank you so much.
Thank you all.
Thank you.
Thanks, everybody.